Good afternoon, everybody. Today is Friday, January the 15th, 2021, and I want to be updating you on COVID-19. So in Canada, we have 69,003,835 cases confirmed in Canada alone. Alberta has 11,004,585 cases, 1,389 deaths. British Columbia has 59,608 cases, 1,038 deaths. Manitoba has 26,954 cases, 755 deaths. New Brunswick has 884 cases, 12 deaths. Newfoundland and Labrador has 392 cases, 4 deaths. Nova Scotia has 1,550 cases, 65 deaths. Ontario has 23,001,308 cases, 5,289 deaths. Prince Edward Island has 104 cases, 0 deaths. Quebec has 23,008,745 cases, 898,938 deaths. Saskatchewan has 19,329 cases, 206 deaths. Northwest Territories has 24 cases, 0 deaths. Nunavut has 266 cases and 1 death total, and Yukon has 70 cases and 1 death total. So these are the cases that we have in Canada. Now I'm going to be moving on talking about the news that's happening in Alberta and the whole province, the whole Canada. So everything you need to know about COVID-19 in Alberta on Friday, January the 15th. Alberta will ease some public health restrictions starting on Monday, allowing hair salons, bar shops, and other personal services businesses to reopen by appointment only. Dr. Dina Hinshaw, Alberta Chief Medical Officer of Health, said Thursday that the province made the decision for the limited reopening after examining everything that was closed after Premier Jason Kenney UCP government imposed tighter restrictions in the mid-December in the bid to curb skyrocketing activity cases, hospitalization, and ICU counts. As Monday, up to 10 people will be also allowed to gather outdoors, and up to 20 people will be allowed to attend funeral. Indoor gatherings remain prohibited, and funeral receptions are still not allowed. On Thursday, Alberta identified another 967 new cases of COVID-19, up from 875 new cases the day before, since reaching a peak on December 7th of 1,767 new cases per day. The 7-day average of daily new cases has been steadily declining in Alberta. As of January 13th, the 7-day average was 875, which is roughly the level it was in mid-November when the numbers were exploding. The province had 12,434 active cases as of Thursday, down from 12,838 on Wednesday. The total of active cases in Alberta have been dropping slowly but steadily since it peaked at 21,138 on December 13th, a day after tougher provincial restrictions kicked in if it that made working from home mandatory for those who could ban in-person service at restaurants, pubs, and bars, and entirely closed entertainment and recreation faculties from movie theaters to gym, personal and wellness service like spas and hair salons. A days earlier, the province has also instituted a mandatory province-wide mask requirement and ban all indoor and outdoor social gatherings with people beyond one immediate household. There were 806 people in hospital Thursday, including 136 in intensive care. Another 21 people have died, for a total of 1,389 deaths. That comes 2 days after the province hit a grim new record with 38 new deaths reported in a single day on Tuesday. 12 schools, about 0.4%, are on alert or have outbreaks, with 15 cases in total. Outbreaks have been declared in 2 of them, accounting for 5 cases in school. Transmission has likely occurred in 3 schools, and all 3 only led to 1 new case. The continuing decline in numbers means fears a post-holiday COVID-19 surge appear not to have materialized in Alberta, and experts say current trends are encouraging, but the province still has some ways to go before a major public health measures can be safely lifted. Before the holidays, Kenny said he was concerned about Albertans might be misunderstand or disregard the stricter rules imposed in December restricting family gatherings, but it appears Albertans generally follow the rules and limited the spread of the virus. A post-holiday spike in cases would be expected to have shown up to data by now, but so far there has been no major increase. Health Minister Tyler Shandro said Thursday that Alberta will see ease some public health restrictions starting on Monday, allowing personal and wellness services businesses to reopen appointmentally only. The changes will impact hair salons, bar shops, ethics, and procedures businesses, and tattoo shops, and other personal and wellness services throughout the province. Appointments should be limited to one-on-one service and businesses, Chandro said, and clients are expected to keep following the public health guidelines. Starting on Monday, up to 10 people will also be allowed to gather outdoors, and up to 20 people will be allowed to attend funeral, with a caveat that will allow who attend wearing a mask and maintain 2 meters of physical distance. So these are this is what's going to be happening. So the restrictions are going to be in effect. For my school, the restrictions are going to be lifted on March 20th, 2021, and hopefully things are going to be there. And those restrictions are also going to be affected for people like there will be only 5 students that are going to be allowed, and I talked about it already in 2020, and I'll mention it again once we get closer to that. Canada is on a rapid growth, a tragic 2,000 more people could die from COVID-19 in the next 10 days, VA said. New modeling released by Public Health Agency of Canada suggests the numbers of daily COVID-19 cases could more than triple to 30,000 if people increase their contact during a time of widespread community transmission. The report also projects that if Canadians simply maintain their current levels of contact with people outside their household, cases count will still rise roughly to 13,000 a day from 7,900 now. The modeler said that based on current cases counts, Canada remains on rapid growth. Tragically, with roughly 2,000 more people expected to die over the next 10 days, as the country approaches a death total of 20,000, as many as 100,000 more people could contract the virus over the next week and a half, public health officials said. Quick, strong, and sustained measures are needed to interrupt rapid growth and maintain COVID-19 control, said the report. Reducing COVID-19 activity urgently needs as rollout of safe and effective COVID-19 vaccine begins. Chief Public Health Officer Dr. Theresa Tam told a news conference that the vaccine rollout, which is now protecting priority groups of high-risk Canadians, will not have a big impact on numbers in the short term. In the terms of the national projection and transmission in the communities, we are not going to see that in the initial months, which is why I think our message is to absolutely get on with the public health measures, she said. Do all of those things, don't non-essential travel, all that really counts. It works, and when you support the projection, the vaccine have a longer runway. Deputy Chief Public Health Officer Dr. Howard said government and external experts are working to determine the impact of COVID-19 rollout on the numbers of the mid and long term. But at the present time, it's really difficult to say. There are so many factors involved. Even today, we're seeing issues in terms of vaccine supply, how vaccines are being rolled out across the country, he said. There's other factors in the term of the increased rates of infection and various parts of the country. So there are so many different factors to play. Right now, Alberta, Ontario, Saskatchewan, and Quebec are the provinces reporting the highest infection rates per 1,000 people. Tam said many provinces, including some that have been on downward trajectory, saw a sharp rise in daily cases numbers after the holidays. That's likely due to people having more contact over the holidays and reduced testing during those weeks, she said. Since the holidays, stronger community-level public health measures have been adopted across Canada, and some areas are showing that the public health measures are working to slow growth. However, we have yet to see the widespread and sustained declines in daily case counts that could indicate we are bringing the pandemic under control nationally, she said.